Top 3 vitamins that help stop proteinuria and heal your kidneys. Kidney health is a critical aspect of overall wellness, as these organs are responsible for filtering waste and excess substances from the blood, balancing electrolytes, and regulating blood pressure. One common kidney issue is proteinuria, a condition characterized by the presence of abnormal amounts of protein in the urine. Proteinuria can indicate underlying kidney damage and, if left untreated, may progress to more severe kidney disease. Among various treatments and lifestyle changes aimed at managing proteinuria and promoting kidney health, vitamins play a vital role. Certain vitamins have been found to support kidney function, reduce inflammation, and mitigate the effects of proteinuria. In this video, we will explore the top 3 vitamins that are essential for stopping proteinuria and healing your kidneys. 1. Vitamin D. The kidney protector vitamin D, often referred to as the sunshine vitamin, is crucial for maintaining healthy kidneys. It is involved in calcium and phosphate metabolism, which is essential for bone health, and it also has significant roles in immune function and reducing inflammation. The role of vitamin D in kidney health. Vitamin D helps the kidneys regulate calcium and phosphorus levels in the blood. When kidneys are functioning properly, they convert vitamin D into its active form, calcitriol. This active form of vitamin D is essential for several bodily functions. Calcium absorption. Vitamin D enhances the absorption of calcium from the gut, which is vital for maintaining strong bones and teeth. It also helps prevent calcium from being lost in the urine, thus reducing the risk of kidney stones. Immune function. Vitamin D has immunomodulatory effects, meaning it can modulate the immune response. This is particularly important in preventing autoimmune diseases that can affect the kidneys, such as lupus nephritis. Anti-inflammatory effects. Chronic inflammation is a common feature of kidney disease. Vitamin D helps reduce inflammation by inhibiting the production of pro-inflammatory cytokines and promoting the production of anti-inflammatory cytokines. Vitamin D deficiency and proteinuria. Several studies have linked vitamin D deficiency to increased proteinuria and a higher risk of chronic kidney disease, CKD. Low levels of vitamin D can impair the kidney's ability to filter waste and regulate blood pressure, leading to further kidney damage. Sources of vitamin D. To ensure adequate vitamin D levels, consider the following sources. Sunlight. The skin synthesizes vitamin D when exposed to sunlight. Spending 10–30 minutes in the sun several times a week can help maintain healthy vitamin D levels. Diet. Include foods rich in vitamin D, such as fatty fish, salmon, mackerel, sardines, fortified dairy products, egg yolks, and fortified cereals. Supplements. Vitamin D supplements can be taken if dietary intake and sun exposure are insufficient. It is advisable to consult with a healthcare provider before starting any supplementation, especially for individuals with kidney disease. 2. Vitamin B12, the nerve and kidney guardian. Vitamin B12, also known as cobalamin, is essential for red blood cell formation, neurological function, and DNA synthesis. It also plays a crucial role in maintaining kidney health and preventing proteinuria. The role of vitamin B12 in kidney health. Vitamin B12 contributes to kidney health in several ways. Red blood cell production. Healthy kidneys produce erythropoietin, a hormone that stimulates red blood cell production. Vitamin B12 is necessary for the production and maturation of red blood cells. Anemia, a common complication of kidney disease, can be mitigated with adequate vitamin B12 levels. Nerve protection. Vitamin B12 is essential for maintaining the myelin sheath that protects nerve fibers. This is crucial for preventing neuropathy, a condition that can affect kidney function. Homocysteine regulation. Elevated levels of homocysteine, an amino acid, are associated with an increased risk of cardiovascular disease and kidney damage. Vitamin B12 helps convert homocysteine into methionine, thereby reducing its harmful effects. Vitamin B12 deficiency and proteinuria. Vitamin B12 deficiency can lead to anemia, neuropathy, and elevated homocysteine levels, all of which can exacerbate kidney damage and proteinuria. Individuals with CKD are at a higher risk of vitamin B12 deficiency due to reduced dietary intake, impaired absorption, and medication interactions. Sources of vitamin B12. To maintain adequate vitamin B12 levels, consider the following sources. Animal products. Vitamin B12 is naturally found in animal products such as meat, poultry, fish, eggs, and dairy products. Fortified foods. Certain plant-based foods, such as fortified cereals and plant-based milk alternatives, are fortified with vitamin B12. Supplements. Vitamin B12 supplements, available in various forms, pills, sublingual tablets, injections, can help address deficiencies. It is important to consult with a healthcare provider to determine the appropriate dosage. 3. Vitamin C. The antioxidant ally vitamin C, also known as ascorbic acid, is a powerful antioxidant that supports the immune system, aids in collagen synthesis, and promotes wound healing. It also has significant benefits for kidney health and proteinuria management. The role of vitamin C in kidney health. Vitamin C contributes to kidney health in several ways. Antioxidant protection. Vitamin C neutralizes free radicals and reduces oxidative stress, which can damage kidney cells and contribute to proteinuria. By protecting kidney tissues from oxidative damage, vitamin C helps maintain their proper function. Collagen synthesis. Collagen is a structural protein that helps maintain the integrity of blood vessels and tissues. Vitamin C is essential for collagen synthesis, which supports the structural health of the kidneys and prevents damage to their filtering units. Immune support. A robust immune system is crucial for preventing infections that can harm the kidneys. Vitamin C enhances immune function, helping the body fend off infections and reduce inflammation. Vitamin C deficiency and proteinuria. Vitamin C deficiency can lead to weakened immune function, increased oxidative stress, and impaired collagen synthesis. These factors can contribute to kidney damage and exacerbate proteinuria. Ensuring adequate vitamin C intake is essential for preventing and managing these issues. Sources of vitamin C. To maintain adequate vitamin C levels, consider the following sources. Fruits and vegetables. Vitamin C is abundant in fruits and vegetables such as citrus fruits, oranges, grapefruits, lemons, strawberries, kiwi, bell peppers, broccoli, and Brussels sprouts. Supplements. Vitamin C supplements are available in various forms, including tablets, capsules, and powders. It is advisable to consult with a healthcare provider to determine the appropriate dosage, especially for individuals with kidney disease. Integrating these vitamins into your diet. Incorporating these essential vitamins into your diet can significantly improve kidney health and help manage proteinuria. Here are some practical tips for integrating these vitamins into your daily routine. Vitamin D. Sun exposure. Aim for 10-30 minutes of sun exposure several times a week. If you live in a region with limited sunlight, consider using a vitamin D lamp or taking supplements. Dietary choices include fatty fish, salmon, mackerel, sardines, fortified dairy products, egg yolks, and fortified cereals in your diet. Supplements. If you have difficulty obtaining enough vitamin D from sunlight and diet, consider taking a vitamin D supplement after consulting with a healthcare provider. Vitamin B12, animal products. Incorporate meat, poultry, fish, eggs, and dairy products into your meals. Fortified foods. Choose fortified cereals and plant-based milk alternatives that contain added vitamin B12. Supplements. If you follow a vegetarian or vegan diet, consider taking a vitamin B12 supplement to ensure adequate intake. Vitamin C, fruits and vegetables. Add a variety of fruits and vegetables rich in vitamin C to your diet, such as citrus fruits, strawberries, kiwi, bell peppers, broccoli, and Brussels sprouts. Supplements. If you have difficulty consuming enough vitamin C through diet alone, consider taking a vitamin C supplement after consulting with a healthcare provider. Conclusion. Maintaining optimal kidney health and managing proteinuria require a multifaceted approach that includes a balanced diet, regular exercise, and appropriate medical care. Vitamins D, B12, and C play crucial roles in supporting kidney function, reducing inflammation, and protecting against oxidative stress. By ensuring adequate intake of these essential vitamins through sunlight, diet, and supplementation, you can significantly improve your kidney health and reduce the risk of proteinuria. Remember to consult with a healthcare provider before making any significant changes to your diet or starting new supplements, especially if you have existing kidney conditions or other health concerns. Prioritizing these vitamins as part of a comprehensive kidney health plan can help you maintain healthy kidneys, prevent further damage, and enhance your overall well-being. Make informed choices, stay proactive in your health journey, and give your kidneys the support they need to function optimally for years to come.